Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello, and welcome to another episode of the Unreal Results podcast. I am recovering from the launch of the fall 2024 sixth online cohort of the LTAP Level 1, as well as this weekend I taught an in-person LTAP Level 1 in Boston, specifically Hanover, which is in the burbs, the south of Boston. And I also visited my friends at Michael Boyle Strength and Conditioning. I've known Michael Boyle for my entire career, and whenever I'm in Boston, I love to go and catch up and talk to him and talk to his staff, and just he's always so wonderful of being open to let me share whatever I'm sort of learning or working through, or like whatever my ideas are. And so it's fun because I always get to push the envelope a little bit in what I share, especially given that they're all in the strength and conditioning space. And so this is definitely, my approach is definitely very new to that type of setting. So we were trying to reminisce on like when we met, like how old was he, how old was I? And also, since I've been, how many times I've come to Boston to speak there. And so first of all, we met back in the day at Athletes Performance. I was a fresh, new athletic trainer, completely new to the world of performance training, strength and conditioning. I think I was a part-time employee at the time at Athletes Performance. He came out to Phoenix for a one-day Perform Better seminar. And all of the presenters that knew Mark Versagen and just knew of Athletes Performance, we all went out to dinner afterwards. And it was great. It was like, I think I was 23 at the time, and probably 23. And so it was all the staff at Athletes Performance, which is phenomenal in itself. And then it was Mike Boyle and I think Darcy Norman, my who's a physical therapist and was one of the OGs with me at Athletes Performance. Sue Falsoni was there. Gray Cook was there, like some legit like OGs. And I remember, oh my gosh, I don't even know if Mike would remember this. So Mike, if you're listening to this episode, you'll have to let me know. But anyways, we ended up going to the bar after the course. We went to a bar in Tempe, Arizona, which is like on the campus of Arizona State University. And we went to this sports bar, and man, I wish I could remember the name of it, but it was like a classic campus sports bar on the west side of campus, just kind of a big one. They had like multiple rooms, tons of TVs, and Mike really wanted to watch the BU hockey game because, of course, he used to work there and work with the hockey team, and maybe even at that time he was. I don't remember his timeline, but anyways, he's like, oh, it's kind of weird to ask for that. and he didn't want to like worry about it. And so I went up and talked to the bartender, and I got the BU hockey game on TV for him, and he was like, "What?" He was so stoked. But I was just like, if I were him, like if the Oregon Ducks were playing right now, I would want to watch them. So even if I was like, immersed in conversation and like socializing with this group of people, I'd still like want my eyes on the game. So totally understood where it was coming from. And I was like, Mike, I got this. I will go and talk to the people. I know they've got a million TVs. We should be able to put the BU hockey game on somewhere. So anyways, that was my first time meeting him. Also my first time meeting Gray Cook, and just a fun memory. But and then for a little while, Mike Boyle worked for Athletes Performance in our LA facility. So I got to know him a little bit through work, and then obviously just kept in touch over the years. Athletes Performance and MBSC would do a lot together. I mean, I think they still do. So always been really grateful for that relationship. And actually in 2014, when I left Exos and I started Movement Rev, after a few months of might have even been after a year or so of being out of that environment, I really miss the interaction with strength coaches. I really miss the interaction and just being in the weight room and focusing on performance training and performance and just being around a group of like-minded professionals. And so I signed up for his strengthcoach.com forum. And that was like, I don't know, probably around like 2016, 2015. And I signed up for the forum just to have some interaction with other people in the industry. And he saw that I signed up and he reached out and he was like, "Anna, why, like, what are you doing?" And also was like, "Wait, I didn't know you left Exos." And really, when I left Exos, I didn't really tell a ton of people. So he was not alone in not knowing that I was on my own, doing my own thing. And so he was like, "Oh, I'd love to have you just like part of the community." And so, yeah, I started being an active participant on the strength coach the strength coach forum that he ran. And then that sort of like rekindled our relationship. And at the time I was traveling to the East Coast quite a bit for some of my athletes. And so he invited me to come whenever I was in town. And that was when I first started speaking over there. And I first shared the Philip Beach work with them. I shared about the rock mats, and then he was like, loved it, like really took the rock mat stuff and the Philip Beach work and ran with it. And then really helped sort of like, I don't want to say launch Movement Rev, but it was a really big endorsement from him, like talking about me a lot in his presentations, talking about that experience in his presentations at Perform Betters and things like that. So I'm so grateful. And then after that, they invited me back to the winter seminar, and I did a formal presentation on it for their winter seminar, I think in I can't remember, it was 2017 or 2018. And then I came back again and presented on breathing in the nervous system. It was like, well, we're going to talk about breathing, which is was a hot topic of the time. I was like, but I want to give you a different perspective of it. And I was like, I want to actually talk about the role on breathing on the nervous system, not just the role of breathing on the body, like from a stability and mobility standpoint. And it was in that that time I went there, he was like, I just love having you here. He's like, because you're always sort of like on the edge, like doing like something different, something new. And he's like, after you come and you speak on something, like, in the next 2 years after that, he's like, everybody's talking, like everybody's already there. Everybody is there talking about that topic. He's like, so you're always sort of like at the beginning of things. He's like, so I love learning from you, love getting his wheels turning and make him think. And that is like one of the hugest compliments that I've ever received. And it means so much to me because like that is truly what I want people to do. Like I just want people to not like take whatever I say or take what anybody ever says for truth and for fact. What I want is for everything I share, for all of my perspectives, for sharing the way I do things, for sharing what works for me. I just hope to encourage people to get their wheels turning and think about how it fits into their knowledge base. Think about how it fits into their practical application of things. And so I really loved hearing that. And of course, so this was the fourth time that I have spoken to him and his staff. And I was like, okay, like I'm going to share with you all about this approach, like that, this whole organism approach that includes the nervous system and the viscera. And I'm going to teach you how to see it in the body and let the body guide you in the direction. And I basically did a quick hour in service on the first test of the LTAP, the SI joint mobility locator test, much like a 1 hour version of the missing link course that I just did a couple weeks ago, or like the results cheat code course that I've done in the past. And it was so cool. And what I really loved about it too, and this is why I'm like giving you the whole history of like all the things I've spoken on there, is because not planned, they have been able to see this transition of me really understanding a whole organism approach, like really understanding what it means to be the whole organism and really understanding what it means to incorporate ideas that, from Philip Beach, that we are like the human organism is like such a highly intelligent, like being that the way we move, the way we develop, the way we do everything is like deeply embedded into our cells. And this other like understanding of how the autonomic nervous system works and how it influences our body and our brain and our being and our health and our ability to heal ourselves and our, ease or disease. And then like the whole journey I've been on tying that all together and putting it in a system that can allow us to look at the body, assess it, and let the body tell us what's going on in terms of like how it's doing as a whole organism, if it feels safe or not, if it's good to just proceed with the plan for treatment or shrink training, or does it need a little support somewhere in the body, and the areas of the body that mean a lot to the nervous system or mean a lot to the like safety and survival of the organism. And when we start there, we see this huge change in dynamic alignment, which then makes our job as coaches or our jobs as physical therapists or athletic trainers or massage therapists, all the things, our job as the professional easier, so much easier, which means when our job is easier, the experience our client goes through is typically better, typically more fun, because we are seeing people be able to be successful quicker without so much dissonance in getting to that end goal. So it was really cool, actually. I was looking forward to the talk regardless, because I always enjoy visiting there, even though it's always quick and I don't ever get enough time to actually like truly visit with the people. But it is always fun for me to share, and it's been cool kind of looking back on it, because I was like, oh wow, I was a little worried going into it yesterday, like, should I share about the viscera? Like, should I share the LTAP even though I'm speaking to a group of strength coaches? Like, are they gonna care about assessment or that kind of thing? And I was like, I don't even know why I was doubting that I would, but it was also like nice for me to reflect and realize like, actually, no, this is exactly what I should be talking about, because it's the perfect evolution of what they've seen with me speaking. Is like, a lot of them heard me speak in performance training for performance therapy things when I worked for Exos. And then I transitioned to this more like osteopathic side of things. And the first thing that really resonated and helped me bridge the gap between the two was Philip Beach's work. So I shared that. And then I shared the nervous system, the autonomic nervous system pieces that I was like starting to filter out. And then I learned more on that. And the whole time in the background, I was also learning visceral manipulation. And so it was like natural that it all built together into this final thing. And, it's not, I've talked about the journey before. I've talked about how I've developed the LTAP on the podcast before. Like, I've alluded to a lot of this already, but I just wanted to share that it was really cool to like, in that specific thing, like really, it was cool to see it, how it's come full circle, and appreciate like all the steps along the way that were like key points. And it was just so happens because Mike allows for such a wonderful environment to share what you're doing. And he doesn't request like, I want you to talk about XYZ. Like I always ask him, is there something you want me to talk about? And his response is like, whatever's on your mind, whatever you feel like sharing, whatever you're super excited about, we want to hear that. And I'm like, just how wonderful is that? And this also too is like when people ask me to like speak at their conferences that are like a year away or, however many months away. And they're like, could you turn in your topic and your little blurb about what you'll be speaking about, so the participants know what to expect, which I appreciate, but I'm also like, it's so hard because I always want to share what I'm currently doing and currently excited about, not what I was excited about 6 months ago. So yes. So with that said, your girl's a little tired. It was a whirlwind of a trip to the East Coast. One of the participants in the Boston course was like, are you staying a few days to like enjoy the scenery, or like, like it's fall is falling in the Northeast, in the New England area. And it was beautiful. And I was like, actually, it literally didn't even cross my mind to be there, like to extend my trip and enjoy myself and like explore a little bit, which I would have loved to do. Like I've always enjoyed going to Boston, and like, I'm just so used to being so busy with travel, especially during this time of year. I'm just used to like not having time for that kind of thing and just fly in and fly out. And so it truly didn't cross my mind until she said. And I wish I would have had the forethought to do that, because it would have been fun to do. And I would have gotten more time to like go to lunch with these guys and say hello, or just go golfing with Sally Moores and Laura Hutto. Like, come on, shoot, I missed the opportunity. But yeah, it was a whirlwind. I flew in Thursday night, and I did a day early just in case of travel issues. I don't want to be like canceled flight and miss my own course. Like that's a bad look. So I came in early. Daniela Spear, she was a teaching assistant for me. She came in early as well. And then Friday, I worked a little bit in the morning since I was still launching the online course. Then we went to Scituate, which it's taken me a long time to be able to say that city name, Scituate, which is on the ocean, on the coast in that area, which was the cutest little small town. And I got to put my feet in the Atlantic Ocean at that area, which, is a big thing that I love. And then we went to dinner Friday night with one of the physical therapists that came for the program, that has also been through the mentorships, kind of like one of the OG Movement Rev alums. Shout out Carrie. And then Sunday, there was a course. Saturday night, one of my best friends that lives in Connecticut, Stephanie, she drove up 2 hours to go to dinner with me, and then got in the car and drove back 2 hours to go home for her family and her puppy. And I was like, you just drove 4 hours round trip just to go to dinner. And that made my heart just so happy. And then, yeah, Sunday the course, Sunday night, I met up with my friend Tina Hoppert. She's Carrots and Cake on Instagram. You've probably heard me talk about her before. She is who turned me on to the HTMA mineral test to find out that I was so depleted in potassium, which has literally been a life-changing thing for me. But she's in my business mastermind with me. And she lives there. She lives in the suburbs of Boston that we happen to have the course in, so small world. So we went to dinner with her. And then, yeah, Monday I did the in-service at Michael Boyle's. And then right after that, I met my friend, one of my internet friends, for lunch in Winchester, Massachusetts. Amy Young. I've been following Amy on Instagram from probably since like 2018 or 2019, and I worked with her back then, and I'm still in her like online community now. She's like she's had many iterations, but like at the most fundamental, deepest thing, she's like a life coach, but she does like somatic stuff and energy stuff and like masculine, feminine type things and like all the things. When I first worked with her, she was a life coach that's supposed to specialize on like relationships. Anyway, she's a phenomenal woman, and I finally got to meet her in person, which, gosh, the internet is undefeated in bringing me people that are my people and like connecting me with like just the most wonderful humans. So that was really special. And then, yeah, went to the airport and flew out, and then 6-hour flight back to San Diego, and the fog was rolling in right as we were landing. So we circled for a while, wasn't able to land, got diverted to Las Vegas. Couldn't get off the plane because I was like, well, maybe this is a sign. Maybe I'm going to make some money tonight. I'm not a big gambler, but sometimes like I do believe in like serendipity. So I'm like, maybe the universe is like, Anna, go put some money in the slot machine in the airport. But that didn't happen. We just sat on the ground waiting for the fog to lift, refueled the airplane, and then flew back to San Diego. Finally was able to land after 9 hours. So it was a long day. So like I said, your girl is tired. I'm in recovery mode. But I wanted to make sure I had a podcast episode for you. So it's a little bit of an update episode. But I also am going to have, last Friday, I did a Facebook Live in the Missing Link group with another one of the alumni from the LTAP Level 1 and the mentorship. My friend and colleague, Julie Embree. She's a physical therapist up in Eugene, Oregon. She works at the local outpatient orthopedic group run by the medical group there in town called Slocum Orthopedics. And she also is a consultant at the University of Oregon for their athletic medicine staff. And that's how we met, is through the University of Oregon connection. And this is why I actually want to share the interview with you all too on the podcast, is because one of the questions I get about the LTAP is how it works in traditional settings. And, like traditional settings, like outpatient ortho clinics that still see a high volume of people perhaps, or no matter the volume, is still insurance based. And you might not have a ton of time with your patients. And so I wanted to bring Julie on because she speaks to that. And actually, it was just such a great interview. That's why I wanted to share it with you, because after talking to her, I was like, man, I knew it would work in those settings because people like her have told me they do. But fundamentally, like, I know it will work so well in those settings because it saves you so much time and it gets you such quick results. And the biggest complaints people have about the traditional orthopedic and traditional athletic training room setting is not enough time with patients and not enough ability to have multiple sessions with patients. And this is a tool that is like solves those two biggest problems. So that's why I knew it'd always be helpful. But I can't speak to those settings because I don't work in those settings. So it was really cool to have Julie on the interview to hear how it works in that setting, what it's done for her, what it's done for her patients, what the doctors think. And she also sees like a lot of the patients. So she's outpatient ortho, but a lot of the patients too are patients who have failed other physical therapy experiences or other medical experiences where even the doctors are sending her people who don't seem to get better, and she's got great results with them. And so, yeah, I wanted to share that interview with you. So I hope you enjoy it. And I'll talk to you again soon. Have a great day. So that's all the housekeeping I had, other than welcome, Julie. Thank you for being here.
Thank you for having me.
Yeah. So if you want to tell the people who are watching this either live or on the recording, what kind of setting you work in, what kind of professional you are, what kind of setting you work in. And then we could talk a little bit about like when you first started learning from me years ago, like what was the problem you were helping to get help with and get solved. And as you've learned the LTAP, like how's that helped you in your clinical practice and how do you utilize it, that kind of thing. Really, whatever you want to share. But those are
Because
the
that's a lot of
those are the
questions.
high points.
As I miss them, you'll help me.
Yes, I will
No,
definitely help you.
yeah. So thank you, number one, for having me.
Yeah.
I'm Julie Embree. I'm a physical therapist. I've been a physical therapist for 39 years, mainly in the orthopedic world. Started in a hospital setting, got out of that, moved to orthopedics, and have never looked back. I have been blessed, I feel like, with the fact that my husband is an athletic trainer and had a job at Oregon. And as a PT at the time, because I'm an older therapist, a lot of the trainers didn't have a lot of back knowledge. And
Mhm.
so I'd go over and help and do all that kind of stuff. And now I've been for years a consultant for U of O athletics, as well as I am a director of the therapy, physical therapy, occupational therapy. It's Slocum Orthopedics, which is a physician-owned, orthopedic practice of about 25 orthopedic surgeons and about the same amount of PAs. But we have our own department of 24 therapists, and, that's kinda where I'm at.
Yeah.
How I got into LTAP is, always looking like I shouldn't say always looking, but always trying to do the best for our patients and kind of like that learner that always like, "What else can we do better?" And, really trying to figure out, like, how do we like, when I would especially go over to the training room, those guys are so great, but there was like I always got the problem patients, and
Yeah.
it's like, okay, and I've taken, like, a bunch of classes, like, I've taken cranial sacral, I've taken the Connect therapy, I've done a bunch of, all the joint mob stuff, and then it happened that Anna kinda hooked up with the trainers, and the trainers kind of always pull me along when they're taking a class, and I pull them along, and it was like a, like, big, huge light bulb because the thing that I think that I love about Anna's class is that she never says, "Throw the stuff that you had before away." So and it's like this guidepost of where do we start and where do we go next, which I love because you can have and kind of that I always was already into the osteopathic stuff, but it's like you can have all these tools in your toolbox, but which one am I taking out?
Yes.
And that's what the LTAP really has done for me and has helped me really go, okay, this is what it is. And even though that football player or my patient, even with a total knee, is saying it's their knee, it may not be their knee. And
Right.
so, really giving me a structure of where I should go, a way to explain it to my patients, and a way to explain it to myself, and a way to explain it to my staff and to the other trainers. Because not all
Yeah.
the trainers over there have taken the LTAP.
Yeah.
And so, just like on Monday, one of them hadn't, and we're going through this groin stuff. And
Yeah.
I'm like, well, blah, 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 and it gives me a direction.
Yes. Yeah, because they
So,
wanna know, like, "Oh, why did you start there?" Like, they're
right.
like, "Wouldn't
Yeah.
have thought that." Yeah.
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 So it
I
gives
love
me
that.
like, where should we start? Which I love. And I think the other thing, because I've been thinking about this since you asked me, Anna, like
Yeah.
the whole thing. And I think the other thing that I'll sometimes say to patients and even to my staff is people that do things well make it look easy. Like
Yes.
somebody that plays basketball and does a lay-in and you're just like, "Oh, that's easy too, you go out there." Anna makes things easy, but the other thing that she does is it's not like she like a good cook that would keep like 2 of the ingredients out of the recipe so that you could never do it. That's not what Anna does.
Yeah.
Anna puts it all out there.
Yeah.
And she makes it so that the other thing is it's like so I'm a PT, but I've been in classes with massage therapists, athletic trainers, a bunch of practitioners. And I don't care where you're coming from, you make it so that everybody understands.
Yeah.
It's not like you're dumbing it down. It's like you're not trying to overcomplicate it. It's
Right.
like, this is what it is.
Yes.
This is how you do it. And if you do these steps, that's how it goes. Sorry, I'm all
Yeah. No, you're good.
yeah.
You're
So
right.
those
Yeah.
are my big highlights, I think, of what I kind of really wanted to share when I kind of
Yeah.
reflected and thought, what has changed in my practice since having taken your classes and followed I don't want to say your prescription because it's not that, but kind of
Yes. In a system.
your
Yes.
system. Yeah,
Yeah.
thank you. Yeah.
The it's funny because like I was like hesitant to call it a system for a while because I used to think of like systems as like kind of like a logarithm, like this and that, which I guess technically it is. Um, because
But
I
it's
would
not
think back,
cookbook.
right. I was like, because I would think back to like the SFMA was like that. And not to like talk, I'm not talking bad about it. It's just like that's not how my brain worked. Like the SFAMA was like very like do all these things, and if it was this, then you do this next. And in that type of logarithm or that type of system, it tells you exactly what to do for treatment, as well as like this is how you do an assessment, this is how you do the treatment, and then like move on this way, right? And
Yeah.
it's still well, ultimately, we know the real problem is it's still in a biomechanical paradigm that I think is outdated. Um, but what I didn't like about it is that you and what I think what made me uncomfortable in any system like that or any logarithm like that is someone telling me how I should treat. I didn't like that. I'm
Yeah.
like
Yeah.
that
But that's
because
what I'm
me,
saying about you. You're saying,
uh,
okay, you need to look at the central nervous system.
do
You
whatever you
figure out
want.
what you yeah,
Yeah, do
exactly.
whatever you
Well,
want, yeah,
this is visceral, do whatever you want, which I
yeah,
love that because I've taken different classes than you have, and other like the trainers have
huh,
taken different classes, but we can all come like Stephanie, who does a lot more breathing, which is
yeah,
another one of the trainers over at U of O. She'll
yeah,
do a lot more breathing than some of the other stuff to get to the visceral system,
yeah, which is fine,
which is great.
yeah. It's that is, like, the thing too, because 'cause I'm like, well, that's kinda like what you said at the beginning is, like, you didn't have to, like, learn a whole new set of tools, you didn't have to throw out what you were doing and already
Right.
worked.
Yeah.
So, I'm like, someone like you who's been a physical therapist for 39 years, like, you have a lot of tools, and, like, you have a lot of things that you know work really well, and so, like, why would you throw that out? I would never want to throw that out, for people, and so this is, like, the biggest thing is, like, yeah, you get to still have the art of being uniquely you and uniquely whatever tools you want to use, but within a framework, so maybe that's a better word to say than system, like a framework that guides you in, like, through the maze of, like, everything you could do or everything that all these objective dysfunctions that like our biomechanical brain wants to fix, like it's like this huge like corn maze and
Yeah.
basically the LTAP helps you to like know when to turn right, when to turn left, when to go
Yeah.
straight to get out of the maze the fastest. And so um
But the other thing that I like is not only is it like me as a therapist or whatever can choose which path, but for different patients, I can choose a different path.
Yes. Yeah.
So it's not stuck in this formula of I have to do something specifically and the patient has to do something
Correct.
specifically. We can work as to this is what the organism is, I mean, not to take away from the
Yeah.
person, needs
Yeah.
to do.
Yeah, exactly. Well, and then like again, it's just I always tell people like to me it opens up so many opportunities because when you know that there's just like one key spot that you have to focus on, you have an opportunity to do it the clinician do it on the patient or you can lead the patient through doing it for themselves. And you're can be sure that the result's going to be the same regardless, really, to
Right.
be honest.
Right.
So it kind of takes the pressure off in my mind of being the clinician and like always feeling like you have to fix people and always feeling like your manual therapy or your exercise choice for them is like the thing that needs to be magical. And it's like, no, your assessment needs to lead you in the spot where the body gets to supercharge your technique and like get the result from it. So
And
I
I
love
think
that.
I think the other thing for me too is I live in insurance, so we do take insurance, and insurance anymore is not allowing, like, again, I'm old and have
Yeah.
seen a lot, insurance has changed. You don't get the 24/12 visits anymore. You
Yeah.
better be good because you've got 6 visits, so you better use them very wisely. And with this system, it lets me do that.
I love that. Yeah.
I mean, so I think that's the other thing in terms of other people that are out there that are on the fence, like, should I do this or should I not? Insurance is not getting any nicer to us.
Oh. And you haven't really had any pushback from an insurance standpoint of like them being like, "Oh, you're treating in an area that's not like part of their."
No, but I'm good with my I mean, I try to
Yeah,
be really
you're
good with
good. You're creative in how you write it up.
Yes.
Yeah.
Yeah,
I'm like, as
exactly.
long as you show like, I'm like, yeah, that's when you know anatomy, you can prove that it's connected.
Yeah. And I
Uh,
always feel like if I ever got stuck like in a call like that, I could go, well,
yeah, exactly. Yeah, yeah, on
we
and on.
started as one cell.
Yes, exactly. Like, okay, insurance
I do
company.
listen to you, Anna. We did
Yeah,
start as
grab
one cell.
your my Daniela, who's here for TA, and she's probably heard me say this as my response to people. I'm like, "Well, grab your cup of coffee and let's talk about how everything is connected."
Yeah, exactly. Exactly.
Um, that's so funny. I was gonna ask, and this is probably actually exactly what you just answered with the being able to help people in their 6 allotted visits, is, if you can look back to, like, when you started learning the LTAP and, like, then brought it back to your patients, like, what do you feel like was their response? Did they really notice the difference of you using it, or they didn't really question it? Or, I mean, did you notice, like, results got faster, so it was, like, more efficient for you possibly? Or did your patients notice it? Or it's kinda like, what was the feedback?
So for me, like in the clinic, I see a lot of patients who didn't do well somewhere else.
Yeah.
So I have physicians who know, kind of what I do. It used to take me longer to do what I do. Now
Yeah.
it doesn't. So part of it, I tell patients, I may do things that are different than what another therapist did. If
Yeah.
you don't like it, there's another therapist you can go to.
Yeah.
But when you're starting to make changes and you make this thing go away, and maybe you're not touching the knee, but
Yeah.
you're still making that pain go away, the buy-in is pretty dang quick.
Yes.
And they
Yeah.
go back to the doctor, and the doctor will say, "What did she do?" And they go, "I don't know, and I don't care."
Yeah. But
I
my
mean, I try to explain it. Some people you can explain it to, there's
Yeah.
different people, different
Yeah.
patients, but I think that's the big thing is that just explaining it. And I often see people that have like they have a pain that's probably not just a musculoskeletal.
Yeah.
So it didn't, you know what I mean? So we do need
Yes.
to look somewhere else.
Yeah.
So I think that's a huge change for me if I think about it, Anna.
Yeah, I love that. Have the doctors asked you? Like, have you had to explain to the doctors at all?
So this is a good story. So I'm lucky enough that well, now there's 4 of them. We go to the Dominican Republic every year,
Uh-huh.
and they do orthopedic surgery, and one of them brings their son with him.
Yeah.
And he was in high school here, and now he's a like, grown up and done all
Yeah.
that stuff, and he had some foot pain. He was running, and so, I did the LTAP, and I cleared the central nervous system, and I did some visceral stuff. Didn't even touch his foot, and he went back to Iowa, where he was, at, and
Yeah.
he was like, "It's all better." So his dad came just yesterday to me, and he goes, "So my son's coming back to town, and he is just wondering if you could work that magic again." And he goes, "I don't know what you do, and I don't care, Julie, what you do.
Yeah.
I don't even think what you do works, but my son believes in you,
That's
and could you
good.
see him for me?"
I love that.
So some of the doctors are like, I think some of them are open, and some of them really just don't care. They just want their patients
Yeah,
better.
they just want the patient to that's
Yeah.
that's the experience with the doc like, my doctor, my supervising physician, he's like I mean, and I've actually worked on him too, like, because he had back surgery, and so he came to me for therapy because where he was going was not helping. And, he's like, "I all the bullshit." He's like, "I don't know what the fucking bullshit you do, but, like, I feel better
Yeah.
and get people better, and
Yeah.
I don't really care. Like, do
Yeah.
whatever you want. Like, you're not hurting anybody. Go crazy. I trust you. Everybody, including me, gets good results. So, like, whatever."
I
And
think the other thing I'm sorry I cut you off, but the
yeah,
other
no,
thing is one of the hip guy doctors likes it to that he won't do a lot of extra testing
mhm.
until I've ruled out some stuff.
Yeah, that's great.
So he wants to go like, is it an infection or is there something just not right that he's not seeing? If I go, something's not right, like I've already cleared all this stuff, then he's
Yeah,
feeling better. So there's that connection that we've made as well.
that's great. Yeah,
Yeah.
that's huge. I mean,
Yeah.
that's, like, as close as you can get to a doctor being like, "This is really helpful information. Could you help me out?" So,
Well,
I don't
you're in, but they don't really
yeah,
care how I do it.
exactly. Like, that's pretty cool. I
Yeah.
love that.
Yeah.
Oh, I love that. That's really cool. Um, this is awesome. I just so this is I mean, obviously, I really wanted you to come on because and talk to people because I get a lot of people well, maybe you can talk about, like, kind of the timeline of, like, the time allotment you have with a patient in the clinic. Um, I obviously have a handful of physical therapists that go through the program, but a lot of them are, cash pay or they work for themselves, and that's just a whole different animal because you're not often stressed for time, and so I know a lot of people there's 2 questions I get when I'm, like, teaching the masses and the missing link. It's sort of like from the athletic trainers, it's like, does this work in the athletic training room environment and like with a lot of people? And then kind of similar is the physical therapist being like, yeah, but does this work in the clinic? Like in orthopedic based or like not even orthopedic, like inpatient, outpatient, like more of a clinical setting where I'm seeing more patients. I don't get to have a lot of time with them and that kind of thing. So how do you
So I feel
is
like
your normal session like?
we're blessed here that we get 45 minutes with a patient. So
Yeah.
that's nice.
Yeah.
I would argue if I had less time, the thing that the LTAP tells me, it tells me where to go right away.
Yeah.
So like that's the blessing. And I will say when I'm at the training room, I don't have 45 minutes.
Yeah.
I get 15 minutes. So
Yes.
because usually they're stacking them up,
Yeah.
so it's like da 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 da. So in terms of that, I in the clinic I am blessed, so
Yeah.
I can do some other things. But I would say because of LTAP, I am better. It's better use of my time and of the patient's time because I'm going okay, kind of listen to your story. I'm not necessarily listening to where your pain is. Moving on to what I
Yeah.
see, treating, reassessing, treating,
Yeah.
reassessing, treating, reassessing, and things move faster.
Yeah.
So even if I had 30 minutes, I feel like that could work.
Yeah.
And I
Yeah.
think the other thing is that there's no reason that if you had assistants that they shouldn't go through LTAP too and could finish off some of the stuff that you started
For sure. Yeah.
or see it as well. I mean, I know
Yeah.
like in the state of Oregon, they can't do assessment stuff, but
Right.
there's no reason that you couldn't show them how to do, some of the
Yeah.
stuff that we do.
Yeah. Absolutely. I the what was I gonna say? Well, and in the outside of training room, and this is kind of how they're bringing you in, obviously, as a consult with the 15 minutes is like, I'm like, yeah, in my head, like if I were in a high school athletic training room, like when you got massive amount of people who need you, in limited time, it'd be like, yeah, like 10-minute triages of like organizing people and what they need in terms of like, okay, you need visceral, you need central nervous system, you need lower extremity. And then it's like, I could then easily have a set, like even like old school style, like a poster in 3 corners of the room of like, try these interventions for central nervous system, try these for visceral, try these for lower extremity. And like just triaging the kids or the patients so that they're starting to work on what the body is directing us to, and then that frees up time for if there is one person that doesn't get a result from those interventions, like, come back and let me actually do a whole evaluation on you, and
Yeah.
so to me, I'm like, "Man, I feel like it would help manage a busy situation way easier
Yeah.
than, like, feeling overwhelmed with
Well,
20
you're not wasting
people.
its time at something that's not the right or whatever.
Exactly. Yeah.
You know what I mean?
Yeah. That's really cool. I love that you see that. I always think like there are every once in a while I get like PT assistants, like PTAs that come through the program. And bless them because they come because they want to learn more and I've end of the day, like most people just want to help their patients, kind of like the doctors. Like, I don't care. I
Mhm.
just want the
Yeah.
patient to feel better. And what happens unfortunately is those PTAs, like they go back to their setting and they start really getting really good at results. And then the PTs they work under, they don't get it and they feel threatened. And then like, they're like, you can't do that. And I'm like, like, it's such a,
We need to stop these wars.
I know. I'm like, God damn.
I don't know that it'll happen in my lifetime, but I sure would love for it to.
I know, but I'm like, man, I wish I could pair up the PTAs that have been my own program.
Yes.
PTs,
Yes.
like, and I'm like, go work for each other because it would be great. So,
Yes. Yeah.
but yeah, that would be really cool. So, was there anything else that you want to like?
No, just a big thank you to you because it's
Yeah,
really changed how I do treat, and it just
love
makes me
that.
keep moving forward. And then, trying as the new trainers come in and even my new staff, just kind of giving them,
Yeah, it's just feed
yeah, exactly.
that. Yeah, I love it. I shout out Slocum too because I was at Devin and I went to the Oregon UCLA game in LA. And you guys, your tent that goes over the medical area.
Yeah.
That advertisement welcome all over the country. It's awesome.
Yeah, we got a new marketing thing so we can just
It's great.
yeah, it's
I
all
love
good.
that makes me feel very at home seeing their name
Me
on the
too.
sideline, like even in Oregon. Like this is awesome.
Good. Good.
Well, it's been a pleasure. Hopefully I see you soon, either in Oregon or at maybe the mastermind if you
There you
come.
go. Yeah.
I've been teasing it, but I'm thinking of like the mastermind this year is going to be like the beta version of level 2 LTAP.
Ooh,
So
that I'd be in for. Yeah. Yeah.
so
Yeah.
so
Okay.
not so mastermindy. It's going to be just an education from Anna weekend, but
Never bad. Either
yeah,
way, it's never bad.
cool. All right. Well, I appreciate your time
Okay.
and happy Friday to you.
Yes. And if people are on the edge of going or not, this
Yeah.
is a great class. It's well worth the money.
Thank you.
Yeah.
I didn't even pay her to say that.
No, it is. It is. It's yeah. Okay.
I love it. I appreciate
All right.
that, Nini. All right. Have a great day.
You too. Bye.